This is Dr. Paul Steenburg, and I made this short video for other healthcare practitioners so I could speak directly as a physician to other healthcare practitioners on an informal basis. I practiced medicine here in Geneva, Indiana for over 3 decades. It was basically a traditional family practice with all the usual things we see, but I had a lot of internal medicine type problems with diabetes in particular, and heart disease, high blood pressure, high cholesterol, and overweight patients. And a lot of my patients' issues were due to their lifestyle and being overweight. And I introduced this program over 5 years ago, and it allowed me to help them in ways that I never could before. It gave me new tools to help them in ways that I never learned in medical school. I learned about the program around 5.5 years ago from one of my own patients who was an overweight diabetic on Januvia, was having trouble affording it. Her diabetes was not controlled, nor was her cholesterol or blood pressure, and her insurance premiums were going up. She heard about this program from a friend in Bluffton, Indiana, and wanted to try it, and left some information, and I looked at it, and I told her it looked safe, but had no idea whether it would work, but she could go ahead and try it. When she came in 3 months later with her labs, it was really quite an amazing experience, because all her labs went from abnormal to normal. In particular, the important ones, A1C, fasting blood sugar, cholesterol, and her blood pressure all improved. Her weight was down, and I was able to get her off of multiple prescription medications. I'd struggled with my own weight my whole life, and I was standing there looking at the lab, 60 pounds overweight for probably the umpteenth time. I thought maybe I would try this program to add to many of the others that I tried, many of the other diets that really I lost weight on but gained it all back. And it was one of the easiest programs I've been on. It was really simple and goof-proof. And I lost 60 pounds over 5 years ago, and I've kept it off. And I'm not afraid of gaining it back, because this is not just another diet, because they don't work. 85% of people on diets will gain it back. And there are a lot of fad diets out there, by the way, and things that we have to be very skeptical of. This program is more of a lifestyle program with a very safe and effective weight loss component that then acts as a catalyst to encourage people to live a healthier lifestyle forever if they so choose. It empowers them to do that. The program is called Optavia, and it has been around for several years. In particular, the parent company is called Medifast, and it was founded by a doctor in 1980 and was originally offered through physicians' offices, and over 20,000 physicians have recommended it. More recently, it transformed into Take Shape for Life, which added on more of a coaching component, and now called Optavia, which is Latin for the optimal way, which encompasses an entire lifestyle program. The company is really rock solid, and I want to address the skepticism that we as physicians have and should have about any program we hear about, because as healthcare professionals, we can't and certainly don't want to offer anything to our patients in our practice that hasn't been, backed by rock solid science and thoroughly vetted, if you want to use that word. The company has been for 2 years in a row on the Forbes 100 best most trusted companies list. It is financially solvent with over $100 million in cash. And after checking it out thoroughly, and I also found that it was studied favorably in a diabetic study at Johns Hopkins, and the chairman of the 8-member scientific advisory panel is Dr. Cheskins, who is the chairman and co-founder, medical director of the Johns Hopkins Weight Management Program. So it really has medical credentials and a medical heritage, and I had and have no fear or concern at all of introducing it to my patients. I've seen quite amazing results in a lot of them, and now since I've retired, I have continued in my retirement to offer this program because it's given me fulfillment and a purpose in life now. In my retirement, I really enjoy it, and I'm able to help, I think, more people than I was helping in my medical practice. My medical practice was basically prescriptive, and prescription drugs can be life-saving, can reduce suffering and prolong life, and they're necessary. But in a lot of cases, they can be diminished, decreased, or even discontinued with improved lifestyle. So anyhow, if you are interested in getting more information, I'd be glad to chat with you anytime and discuss how it might be integrated into your practice. Or it could be a referral-based practice, because we're always willing to help others, and other physicians in our community have been referring their patients to me who have obesity and are overweight and have other medical problems related to their lifestyle. The 4 pillars that make this different from others are health coaching and habits of health lifestyle system, a lot of support and live webinars that teach a healthy lifestyle, and rock solid nutrition. And as our people are getting healthier by losing weight, they're learning new healthier habits and healthy nutrition so that they can maintain their newfound health and lifestyle forever if they so choose to do so. So anyhow, go ahead and get back with me if you would like more information to see how this can be pretty seamlessly integrated into your medical practice. I had no trouble introducing it, and it worked seamlessly into my practice during regular office visits. And I know some practices have used employees to introduce the program and manage it, but it really is turnkey and patient directed, and the physician or the coach is just the guide. So anyhow, I hope to be able to meet with you or chat with you on the phone or do a video chat and explore this more with you and see if you feel it may be a fit for your practice and a way that you can truly get your patients healthy in ways that you never could before. Thank you.